So you guys responded so well to the last video I did on the topic of rib remodeling. I thought I'd do another one and do a deeper dive and let you guys know what's involved with this surgery, what to expect, and the advances that have been made over the past few years. I think the future of feminizing surgery for the body are a lot like feminizing surgery for the face. In some folks who are assigned male at birth, in order to feminize things in the face, for example, we just need to do bony work. So that would be reducing the brow, typically reducing the jaw. And we're beginning to realize that when it comes to the body too. For example, Dr. Barry Epley, a mentor of mine in Indiana, has been doing shoulder reduction surgeries for many years now, and can knock, I think it's about between 2 and 3 centimeters off each shoulder by narrowing the clavicle and working on the bones there in a very nice, successful surgery. But more recently, for the trans community, I think rib remodeling is going to be a game changer. Typically, in folks who are assigned male at birth, they tend to have what we call a more barrel chest. So if you look at a patient from behind, it's just difficult to narrow in that waist because the lower ribs, usually the 12th, 11th, 10th rib, sometimes 9th as well, just take up too much space and just like stick out too much. So it was described back in the day removing these ribs through an incision back there, but a lot of people think this is a little bit extreme, removing the ribs. Your respiratory function is probably just fine, but the more modern way to do it is not to remove the ribs, but to remodel them, just to change the shape of the ribs. Dr. Manzanetta from Lima in Peru actually pioneered this, what's called rib scar technique, and basically it means no scar when you're doing this. And so basically it involves a few little punctures on the back, where we go in, we don't do a full break of the rib, we bend it in the direction we want it to go, and in this way, along with using a corset, usually for about 3 months, we can get incredible results that we wouldn't have otherwise gotten. This can be done with liposuction if the patient needs it or chooses to do that, or it can be done by itself. Surgery itself takes about an hour to do. Typically, we do it under general anesthesia. Patient goes home the same day. We put them in the corset, and it's super important that they wear this corset for 3 months. During this time, when everything's healing in and the ribs are healing in their feminized position, patients aren't able to exercise for the most part. So there is some downtime and certainly commitment involved on the patient's part in order to get the nicest results possible. But the patients with this, depending on their anatomy before the surgery, can lose several inches off their waist and get really nice results that just wouldn't have been possible otherwise without the rib scar technique. I'm seeing patients for this procedure now. We're offering it here in Miami, and so far there's a lot of excitement about it, and I think it's going to, like I've mentioned before, be a game changer for trans feminine patients moving forward.